Dear esteemed partners, supporters, and friends, it is with sincere conviction and a deep sense of purpose that I extend this message to you on behalf of the Africa Respiratory Care Association, ARCA. Founded in 2024, ARCA is a legally registered non-profit organization in the United States of America and Ghana, and an official chapter of the International Council for Respiratory Care, ICRC. We are driven by a singular, urgent mission to advance respiratory care in Africa through education, advocacy, policy development, professional growth, and international collaboration. Our vision is bold but necessary to ensure that every country across the African continent has trained respiratory therapists and accessible, high-quality respiratory care services, regardless of economic or geographic limitations. Our core objectives: advocacy. Be a strong advocate for respiratory therapists, working towards recognition, licensure, and regulation in all African nations. Public awareness. Raise awareness about respiratory health issues and the role of respiratory therapists through public campaigns and community outreach. Annual conferences. Organize annual conferences featuring world-class speakers, workshops, and cutting-edge research in respiratory care. Student exchange programs. Facilitate student exchange programs, allowing respiratory therapy students to gain international experience and perspectives. Promote excellence. ARCA is committed to advancing the standards of respiratory care in Africa through education, research, and best practices. Professional development. Offer continuous learning opportunities, scholarships, and mentorship programs for respiratory therapists and students. Collaboration. Foster connections with respiratory care associations worldwide to exchange knowledge and expertise. Facilitating global partnerships. Collaborate with healthcare professionals to advance the practice of respiratory therapy in Africa. Despite the immense burden of respiratory diseases in Africa, from asthma and COPD to tuberculosis and post-COVID complications, most of our countries lack a trained respiratory workforce. Presently, only Ghana, Egypt, Liberia, and Ethiopia offer respiratory therapy as an academic and professional path. This gap in care continues to leave thousands of lives at risk. The COVID-19 pandemic revealed what we already knew. Respiratory therapists are essential. Globally, demand is rising, projected to grow 13% between 2023 and 2033 in the US alone. Yet in Africa, a critical shortage persists. ARCA was created to fill that void. We are advocating across the continent. We are engaging with ministries, universities, and healthcare institutions. We are raising awareness, hosting training sessions, and creating professional networks. We are building the future of respiratory care in Africa, but we cannot do this alone. We are calling on governments, donors, international organizations, healthcare institutions, foundations, and individuals to support our work. Your contributions, financially, technically, or collaborative, will help us. 1. Establish new respiratory therapy programs in African universities. 2. Train and equip the next generation of respiratory therapists. 3. Provide scholarships and learning resources. 4. Host conferences, research initiatives, and public health campaigns. 5. Expand our reach to underserved regions and strengthen local systems. Every donation, every sponsorship, and every partnership helps us breathe life into a continent that needs it most. Your support is not just a contribution to ARCA, it's a contribution to health equity, to saving lives, and to empowering African healthcare systems for generations to come. We invite you to join us. Partner with ARCA. Support our mission. Help us realize a healthier Africa, one breath at a time. For sponsorships, donations, or inquiries, please contact us at info@africareps.org or sponsorships@africareps.org. You can also visit us at www.africareps.org or call the following numbers: USA +1 952 228 1482, Ghana +23 3242 130 397. Thank you.